All right, let's get right into it. Today, we're looking at a pretty radical new model that connects a whole cluster of chronic health issues. We're talking everything from pelvic pain to anxiety and traces them all the way back to a single event at birth. Honestly, it's a completely different way of thinking about how our bodies tell their stories. So, if you've ever found yourself dealing with chronic pelvic pain and irritable bowel syndrome and anxiety all at the same time, you've probably asked yourself this exact question. It can feel like your body is just fighting a war on multiple fronts, right? Well, the research we're diving into today suggests these aren't separate battles at all. They might just be the downstream effects of one single root cause.
And this is exactly why it's such an enigma for modern medicine. So many people have this experience. You go to a gastroenterologist for your gut, a gynecologist for the pain, a psychiatrist for the anxiety. Each specialist is an expert in their own silo, but they often miss the bigger, systemic issue that's driving everything. It's a fragmented approach that can leave you feeling completely unheard and, frankly, without any real answers.
So, where does this whole story actually begin? According to this developmental model, it all starts right there in the delivery room with something called a primal insult. Specifically, we're talking about neonatal hypoxia. That's a period where a newborn doesn't get enough oxygen during the birth process. And this one event, this single moment, can kick off a lifelong cascade of biological changes. Okay, so how does the immune system get looped into this? Well, if that oxygen deprivation is complicated by meconium aspiration, it becomes much more than just a breathing problem. That meconium acts like a super antigen, triggering this massive inflammatory response in the lungs, what's known as a cytokine storm. This event essentially trains the baby's brand new immune system to be on permanent high alert for the rest of its life. And often, the first sign of this is childhood asthma. Now, at the very same time, the newborn's body is making this life-or-death calculation. To survive the lack of oxygen, it triggers something called a diving reflex, which shunts all the precious oxygenated blood to the most critical organs, the brain and the heart. But there's a cost. It cuts off blood flow to what it deems non-essential organs, and that includes the uterus. Research now shows this can cause permanent stiffness in the uterine arteries, basically leaving the uterus in a state of chronic, low-grade oxygen deprivation, setting the stage for diseases like adenomyosis decades later. And, of course, the brain is also profoundly affected. That lack of oxygen can injure the white matter in the prefrontal cortex. That's the part of our brain that handles things like impulse control and focus. This can lead to what some researchers are now calling secondary ADHD. And the key point here, the really crucial thing, is that this isn't genetic. It's an acquired brain injury that just happens to mimic the classic symptoms of ADHD. Okay, so this flowchart right here is our guide for the rest of this. It's the developmental cascade model. As you can see, it maps out the whole journey from that primal insult at birth through childhood and adolescence, all the way to what can feel like a total systemic collapse in adulthood. Let's take a look at phase 2. So during childhood, the initial trauma might seem like it's gone away, but it's really just simmering below the surface. The sheer terror of that birth asphyxia can imprint itself on the amygdala, the brain's fear center, and that can lock the nervous system into a permanent fight or flight state. That's where the anxiety comes from. At the same time, the vagus nerve, which controls our whole rest and digest system, can get injured, leading to chronic gut problems. So the issue isn't what you're eating, it's the wiring itself. Now we get to phase 3, and this is where the pain really starts to show up. To get this, we need to understand a really key concept: nociplastic pain. This is not your typical pain from, a cut or a broken bone. This is pain that's actually generated by the central nervous system when it starts to malfunction. Your brain and spinal cord essentially turn the volume dial on pain signals all the way up. The pain itself becomes the disease. And this diagram here shows you exactly how that works. On the left, you've got normal pain processing. A signal goes up to the brain, and the brain sends a calming, "it's okay," signal back down. But look at the right side. With nociplastic pain, the spinal cord goes into this state called wind-up, amplifying the signal. Then the brain gets it and amplifies it even more. And that descending off-switch signal, it gets blocked. The result is just widespread chronic pain. Let's put it an even simpler way. Normal pain is like a fire alarm that goes off when there's an actual fire. It's a useful signal, right? The alarm fits the situation. Nociplastic pain is like that fire alarm is broken, and it's just stuck in the on position, blaring 24/7 even when there's no smoke, no fire, nothing. The alarm system itself is the problem. So how does all of this come together to create a specific gynecological disease like adenomyosis in adulthood? Well, the researchers call it a 3-hit process.
First, you've got the vascular hit from birth, those stiff, oxygen-starved uterine arteries. Second, you add in the immune hit, that hyperreactive immune system that's just pumping out inflammation. And then third, there's the trauma hit. We now know that severe stress early in life can increase the risk for these conditions by a staggering 60%. And all of this leads to a phenomenon the source material brilliantly calls the evil twins, viscerovisceral cross-sensitization. It's a fancy term, but it's the reason why intense pain in one pelvic organ can make everything else around it hurt too. It is absolutely not in your head, it's in your nerves. So why do the bladder and bowel get dragged into this mess? It's because, as you can see here, the uterus, bladder, and colon are all wired into the exact same nerve roots in the spinal cord. It's like they're on a party line. So when the uterus is screaming with inflammatory noise, that signal spills over to its neighbors. The brain, which is already sensitized and on high alert, can't tell the difference. It just interprets all this crosstalk as pain coming from the bowel and the bladder as well. And this slide is the big aha moment. This is the unified theory. This is where we connect every single dot. The childhood asthma? Not random. It's from that initial immune priming. The ADHD? That's the frontal lobe injury. The anxiety? Amygdala sensitization. That widespread achy arthritis pain that doctors can't explain? It's nociplastic pain from central sensitization. And the adenomyosis? It's the combination of uterine ischemia and immune dysfunction. It all tracks back. Which brings us to the really powerful conclusion of this research. What we're looking at here isn't 5, 6, or 7 different unrelated problems. It is a singular, interconnected condition, a post-traumatic neuroimmune syndrome that was set in motion by that one event at birth. And what's so crucial about this is that this new understanding demands a completely new approach to treatment. Instead of just treating the end organs, the gut, the uterus, we have to heal the entire system. That means things like targeting the vagus nerve to calm the nervous system, treating nociplastic pain as a software problem in the brain, and using trauma-informed care that truly acknowledges the deep, preverbal nature of this original injury. You know, this reframing is just incredibly powerful. It validates what can be years and years of confusing, painful, and isolating experiences. And it leaves us with this really empowering question. What if the first step toward true healing isn't another pill or another procedure, but finally understanding the true story of how our bodies got here in the first place?